And then you have to close your eyes, relax the whole body, relax the whole body. Let there not be any obstacles or tension or stress anywhere in the flow of energy and the blood. I request every one of you to kindly mute your phone for the time being so you can focus on meditation. Once we witness or watch our thought, flow of thought is nothing but mind. When we watch our mind, mind becomes silent. When mind becomes silent, the frequency of thought will come down. If the frequency of thought is very high, above 15 thoughts per second, it is called alpha level. Then a person in that state of mind, person will be having more anxiety, tension, stress, anger, etc. By watching your thought, automatically the frequency of thought will come down. You can reach to beta level, where frequency of thought will be 7 to 14 thoughts per second. In beta state of mind, you will have more concentration than alpha state, and you will not be disturbed easily. If you practice for some time, you can even reach theta state of mind, wherein the frequency of thought will be 4 to 7 thoughts per second. You will be very, very meditative. Even if somebody scolds you, you are not perturbed, disturbed. You will gain lot of concentration power. Perception level will improve when frequency of thoughts comes down. You have to simply watch your thought. Don't allow any thoughts to crop up. It is in your hand. If you practice this for a long time, you can even reach delta state of mind. Delta means we know where the river meets the sea. But in meditation language, delta means where the individual consciousness meets the universal consciousness, on par with the universal consciousness. In other words, you will be staying in prajna. Upasthita in prajna means sthita prajna. You will understand the whole world, that everything is energy and consciousness. You are also part of that. Even acupressure, you will totally understand when your state of mind is completely close to at least theta level. Yesterday, I had told you that when there is no mind, it cannot take you haywire. Automatically, you will come to presence. Mind cannot take you haywire, so automatically you will not go to future or past. Otherwise, mind will be, chattering. Something, whether wanted or unwanted thoughts will flow. We can just observe the mind to make the mind silent. Don't allow any thoughts to crop up. Now we'll do Omkara. By doing this Omkara, it is not a religious activity. It is a spiritual activity related to any religion, because by doing Omkara, the vibrations of A, O, Ma put together will spread to every nook and corner of the body, rejuvenates the whole energy circulation system. So take a deep breath while exhaling, chant Omkara. Between the two Omkaras, observe the vibrations of Omkara spreading to every cell of your body. Take a deep breath while exhaling, chant Omkara. Omkara is consisting of Akara, chant Akara. Nabi and below, the reproductive organs gets vibration. When we chant Ukara, respiratory and circulatory system gets activated. When we chant Makara, entire neck and head, including all the cells of the brain, will get activated. So last time again, you take one more deep breath while exhaling, chant Observe the vibrations of Om spreading to every cell of your body. Now, gently rub your palm, make a cup out of it, close it on your eyes, slowly open your eyes. Friends, hitherto we have learned what is homeostasis and what is component of blood. Yesterday, one or two freshers, they told me that, the last portion, especially the grouping of blood, they wanted one more revision. I'll request our beloved faculty to summarize before we go ahead or whenever the time permits. Friends, the journey on anatomy and physiology will be very, very interesting in the days to come because we are going to deal on systems like digestive system, respiratory system, circulatory system, excretory system, nervous system, skeletal system, reproductive systems, etc. So all these systems will be covered. Then you will be able to understand any variations. When a patient comes, it will help you to diagnose properly. So we are really lucky and privileged to have a tutor like Dr. Neelima Patil, who is an authority on this subject, I should say, because she has the potential to teach even the tough subject. She will convey to you like a story.
Thank you so much.
I'm sure you will enjoy the session. On behalf of all the participants, I extend a hearty welcome to Dr. Neelima Patil ji and requested to take charge. Namaste, madam. Welcome.
Thank you so much, sir. Thank you. We'll just do a quick revision of yesterday's blood grouping system. Good evening, everyone. And then we'll go ahead. Okay. So yesterday I was teaching you about the blood grouping. So actually there are many type of blood group system, but we are generally what we follow is ABO system. So ABO system, in that what is there generally, if you see that the RBCs on the surface of that RBC, if you see a RBC, if this is your RBC, right? On the surface of it, there is a glycoprotein. This is a protein. Okay. And what we call it? We call it agglutinogen. Agglutinogen. Okay. So this is, I told you agglutinogen, they are of how many types? How many types of agglutinogen I told you yesterday? There are two types.
Two types.
Right. So what are they? They are A agglutinogen and
B.
B agglutinogen. Now if you see here, this is the RBC, and RBC, it is flowing in the blood, and in the blood there is a counter protein. So it is moving along with, that is agglutinin. Okay. So that is agglutinin. That is the counter protein. Please mute everybody, if the noise is there at your end. So now if you see this, there is agglutinin. Now, how many types of agglutinin yesterday we saw? Again, there are two types. So that is alpha and beta. Okay, alpha and beta agglutinin. Okay, so these are the counter proteins. Now, what happens if you see this, when the same, if A agglutinogen, it comes in contact with alpha agglutinin. So if they are in the same blood, what is happening? When they are in the same blood, when they come together, they will agglutinate. That means they will form a clot. Okay, they will form a gutli banayega wo. So they will agglutinate means what? They will form a clot, a thrombus. Okay, so the rule is that when there is A agglutinogen, alpha agglutinin cannot be there in the blood. So if now we come to the, we'll make this table. If there is A agglutinogen, then which agglutinin will be there in the blood? Beta, right? So there will be beta agglutinin. If B agglutinogen is there, then which agglutinin will be there? Alpha. And if both A and B are there,
no agglutinin.
No agglutinin will be there. And if there is no agglutinogen, nor A nor B, then what agglutinin will be there in the blood?
Alpha beta.
Okay, this much clear, everyone, right? So now if we see what are the blood groups they are forming, then if we see, they are forming the blood group
ABO.
Yeah. The blood group will be, when A agglutinogen and beta agglutinin comes, it forms A blood group. And when beta agglutinogen and alpha agglutinin comes, it forms B blood group. When there is AB agglutinogen and non-agglutinin, it is a blood group AB. Okay. And when there is no agglutinogen and there are both the agglutinin present, then this becomes a
O positive.
O blood group. Okay, no O positive. This is not positive. Positive has yet to come. Now, what we saw yesterday, we also saw that they found that besides this agglutinogen, A and B, there are two types of this agglutinogen, A and B. There is one more glycoprotein. And that glycoprotein, again, it is on the membrane of this cell. Okay, RBC. So if you see here, this is maybe like, a smaller one. And this glycoprotein, it is found in rhesus monkey. Rhesus monkey. Okay. So what they said, they found that 85% of the people, they have got this glycoprotein. It is present. But in 15% people, it is not present. It is not there. So then now comes, if this rhesus monkey glycoprotein is present in the blood, then it is Rh positive. So now here next what will happen when we are writing the blood group? Now here there will be again two types of blood group. Okay, with the RH factor. RH factor means what? With the rhesus monkey glycoprotein. So it will be A positive if it is present, or it will be A negative. If it is present with a person with a B blood group, if it is present, it is B plus, and if it is not, then it is B negative. Same thing with AB positive and AB negative. Then same with O positive and O negative. Is this clear now? This is how the blood grouping has come. So when there are agglutinogen, agglutinin, and the RH factor, these three, they decide your blood group. Fine? I'll just show you a picture. One moment. See here, you can see this. Sorry. Here, see how it is showing. So it is type A, type B, type AB, type O. So who's there? Red blood cells, surface proteins are present, and then there are the plasma antibodies. So beta agglutinin, alpha agglutinin, no agglutinin, and with this again there should be a last column of RH factor. So if RH factor present, it is positive. If it is not present, it is absent. Okay. So with that, now we come to the new chapter, that is the digestive system. Now I hope you all know digestive system. It starts from where?
Mouth.
Mouth. Everybody agrees to it? From the mouth?
Yes.
No.
Yes, ma'am.
Mouth. What is your mouth? Where does it start?
Ma'am,
Tongue.
tongue and saliva,
Teeth, tongue,
Salivary glands,
teeth,
teeth, tongue,
esophagus,
Okay. What else?
stomach, spleen.
No. Actually, if you see, you all are correct when you said mouth. So if you say this is the malus meridian, mouth to anus. Okay. Professor Park Jae-woo, he described digestive system as manus meridian. Okay. Mouth to anus, and this is something really very, very important meridian. Mouth to anus. So mouth to anus is our digestive system, but our mouth, where does it start? It starts with your lips. Okay, lips play something very, very important role. You all put lipstick on it. Why do you put lipstick? Important, no? That's why you put that lipstick on it. Okay, so it starts from the lips. Okay, so now of all the system, this digestive system, it is something very, very important. Why it is important?
is the source of post-heaven energy.
Yes, it is the source of post-heaven energy. So whatever like pre-heaven you have got, it is going to nourish the post-heaven. So that is why it is something very important. And as I told you in the first or second class, that we cannot prepare our own food, right? So because we cannot prepare our own food, this digestive system, it is something very, very important. Now, the other day we saw there is a cell, then many of the cells, they come together, they form the tissues. When many tissues come together, they form the organ, right? And when many of the organs who are performing the same function and they have similar structure, what they form? They form a system. So this is how this digestive system, it is come into picture. So we have many of the system: respiratory system, excretory system, circulatory system. So this is one of the digestive system. Now what is the work of this digestive system? It is
the complex food ko a small divide.
digestion of food. Simple.
Yeah.
Don't make it very complicated. It is something very simple. Digestion of food. It is going to do that, and it is going to nourish your body. Okay, so post pre-heaven essence को यही जो है digest कराएगा food को और उसको nourish करेगा. Now where does it start? What is the function of this? I told you it starts from the lips. But what is the function of this? Digestive system का function क्या है?
Absorption.
Digestion.
Digestion,
Don't
absorption.
jump. Wait.
Injection, digestion, absorption, or excretion.
Yeah, it is ingestion, not injection. Ingestion. Ingestion means what? First, you have to eat something. What you have to put something in the mouth, right? So this is ingestion. After that, it is digestion.
Digestion.
Right? Digestion means what? It will
Breaking of food into smaller
Yes.
pieces.
It will break down the food into smaller pieces. After that, what will happen? It is absorption. Means what? Whatever the broken down pieces, now, like, they have been converted to the smallest unit, and now it is going to get absorbed in the, where it is going to get absorbed?
Small intestine.
But where it will go from the small intestine?
Large intestine.
Blood.
Blood. It will go to
Blood,
the blood.
ma'am.
From absorption will be done in the small intestine, but small intestine से कौन लेगा इसको? Blood लेगा. Okay, and then what the blood will do? Blood will send it to different kinds of cells. Okay, वो cell तक पहुंचाएगा. Each cell, how many cells you have got?
Trillion, 100 trillion.
Trillions of cells you have got. So the work of this blood is to send all this food to the each and every cell. Right? After that, what it will do? It will do assimilation. Means
Assimilation.
what? Assimilation means whatever now the food we have taken, what it will do? Sorry, after absorption, after it absorbs in assimilation, it will take to the each cell, and then it will, if it wants to grow, it will do the growth of the cells. So it will assimilate. Okay, so digestion, in digestion, the absorption is there, and in the assimilation, the food will go to each cell. And lastly, after done all this, whatever is not needed, and if there is some breakdown, whatever the roughage material is there, if it has to be excreted out, it will be excretion will be taken place. So there will be excretion. So whatever the remains, everything undigested, unwanted toxins, whatever they are, like, everything will be excreted out of the body, right? So this is how the function of the digestive system is there. Now if we see, how does the digestive system look like? As I told you, digestive system, it starts from the mouth, but not exactly mouth, it starts from the lips. So now when we go to the mouth, is it only the mouth part? No, it is not there. There it is your lower mandible, the upper mandible is there. Then in the mouth, your teeth are there. Then your tongue is there. Then there are the salivary glands present there. Then after that, there is the food pipe, the pharynx, right? Pharynx, larynx, everything. And after that, then what will happen? It will go to the stomach. See this picture? Now it will go to the stomach. From how it will go through this food pipe, and then from here, from the stomach, now this stomach is like a pouch, it will go to the small intestine, right? Now this small intestine, you all can see here, the small intestine is a very much coiled structure. It is quite big, but the diameter of the small intestine is small, so it is known as the small intestine. And after the small intestine, it will go to this large intestine, you can see here. Okay, so this large intestine, it is like thick rope, and in between there are still again some parts, like appendix is there. Here a small intestine is divided into 3 parts. Okay, then this large intestine, the last part of it, this is the rectum, and from which the excretion takes place, that is the anus. Okay, so actually, are these the only ones? No, there are, like, the liver also. Liver is a supporting organ here. Then there is pancreas also. Then there is gallbladder also, which is supporting. Okay, so all these are supporting the digestive system. They are not taking directly function in the digestive system, but yes, they are. Only here, like if you see, the spleen is not directly involved, but your liver. So actually, liver is something really very, very important in digestion. Though it is not taking it, the food is not going to it directly, but yes, it has got very important role. Are there any glands involved here? Yes, there are glands. Liver itself is a gland. And after that, your pancreas, that is the
Yes.
gland which is helping it, right? So, and here we saw up, there are the salivary glands. So the glands are also involved here. The full digestive tract is involved here. And plus the liver is there, liver and gallbladder, right? So now we come to the first part. Now mouth. If we see this mouth part, as I told you, this mouth, it starts with lips. So if you see at any time when these politicians, they break the fast, what? Please mute yourself, I request. Sorry. So if you see
मैडम आप म्यूट हो गए।
sorry, yeah, sorry. So when these politicians, they break the fast, what is given to them? They are given a glass of juice, right? So when the glass of juice is given, immediately after that, that person who is fasted, he feels good. Why he feels good? Because through these lips, your lips, it is very thin. If you have seen the skin on this, it is very thin. And from here, everything, I mean that the juice gets absorbed. So many times, if you see, if you feel very thirsty, it is not that you drink water from the bottle. You don't feel thirsty unless you put the bottle to your lips. So it is because here you can see. And if at any time you see that there is less water in your body, these lips will start cracking. So actually, one of the major signs of the in TCM, I think the second and third, fourth semester people will understand, large intestine hotness. When it occurs, the lips, they become dry. So that is a typical sign of that. So these lips are something very, very important. So you are supposed to pay attention to the lips also. How are they? So are they dry? Are they excessive wet? Is there any discoloration on the lips? They show so many things. So we'll study that later. Okay. So that is about the lips. Then coming to the tongue. Now if we come to the tongue, see this tongue, how much it must be? 2.5 inches or 3 inches long. Okay. What is the role of this tongue?
To push the food. To push the food.
The food.
I mean to.
This is a fibromuscular structure. Okay, it is a fibromuscular. There is no bone in this. It's a fibromuscular structure, and there are no bones. But what it does, it mixes the food. How it mixes? It rolls. Right, the tongue, it rolls around, and because of which, when it rolls around, it mixes the food well. So when you eat bhaji, chapati, or dal and rice, what it will do? It will make a nice bolus out of it, right? And then it will mix what? It will mix the saliva with. Okay. Then this tongue, it helps in speech also. Okay, so if someone has a difficulty in speaking, especially the smaller children, generally they say उसकी जीभ मोटी है इसके कारण वो बात नहीं कर सकता है. मराठी में भी वो कहते हैं कि त्याची जीभ जड झाली है, like they say here in Maharashtra. So it's become heavy, it has become thick. So because of that, he's not able to speak. So this tongue, it has got a very important role in speech also. And not to forget the taste buds. There are various taste buds. You will learn about them also later. So on the sides, there are sour taste buds. On the tip, it is sweet, right? At the back, it is bitter. So this is something really very, very important one. Then after that, we come to the next one. I'm able to erase anything. Sorry. Let me see. Yeah. Now coming to the teeth. Now, whenever you visit a doctor, see, you have how many set of teeth? 1, 2, 3, 4. Are there 4 set of teeth? Or 1 and 2? How many set of teeth you've got? 2, right? There are 2, upper and lower one. So now if you see when you visit a dentist, what does the dentist write is? Dentist will make a column like this. Right? So this will represent the upper teeth and this will represent your lower teeth. And this center one, from here the teeth starts. So the ones which are in the center, they are the 2 teeth. They are your incisors. Next to it is your canines. Then there are premolars. And then there are premolars. And lastly, there is your wisdom teeth. Right? So in each quadrant, there are 8 teeth like this. So first one is the canine. It's not canine, incisor. What does the incisor do?
Cutting.
Cut.
Cut?
Chew.
Cut.
Yes, bite. They do cutting or biting. Apple आप सामने से ही काटते हो, right? So that is the incisors. There are 2 in number. Then there is one canine. Canine is a little sharp one. What it will do? It will do the job of tearing. नहीं, आप गन्ना खाते हो ना? So you tear it from the side. आप सामने से गन्ना नहीं खाते हो कभी. आप side से खाते हो. वो tear करेगा. So this is basically the canines. If you see in the dogs, they are very sharp. So in animals, it is used for cutting the flesh. Okay. So there are 2 incisors, 1 canine. After that, there are 2 premolars. So these premolars also, they help in chewing. Okay. And then there are 3 molars. So molars basically, they grind the food very well. And lastly, one, it is the wisdom tooth. Okay. And let me tell you all that these teeth, they are the foci. Dr. Wohl has called them the foci. So never you should, if there is some pain in the teeth, it is showing that some problem is there inside the body, because Dr. Wohl has connected each and every teeth to one organ in the body. Okay. So when you learn about Dr. Wohl's, then you will come to know. So basically, if you treat that internal condition, your tooth pain will also go away. But many times, what I have seen, that if there is a pain in the tooth, it is because of the stomach heat or large intestine heat. तो पेट का कुछ गड़बड़ है, तो तभी आपका दांत का दर्द बहुत होता है. So actually, if you take out the heat, it just settles. And there are very good points for those. And definitely, you can treat them very, very easily. Okay. So these are about the various teeth. Now, what is the work of this teeth? To grind, as I said, to make the food into very small particles, right? So why it has to be ground to small particles?
For easy digestion, absorption.
Means what?
I mean to break into
Saliva makes the food.
No, it is not exactly to mix the food, but yes, to increase the surface area. of the food particles, so that the acid and enzymes, whatever are present, they can act upon this food particle very well, so that their digestion will be easy, and in the same process the absorption of the food will be also very easy. So actually, like the other day also I told you that we've seen that the diabetic patient, generally what they do is they eat in hurry, so they don't chew their food very well. So because of that, what is happening? Indigestion is there, right? So because of that, the God has given you 32 teeth. So actually, every time our grandparents and parents tell us that you should at least chew one bite for 32 times. So that is to make it mix with the saliva, ground it to the pasty form, so that all the acid and enzymes can work upon it. Right? Now, after that, who's there? The saliva. Now, this saliva also, how many pair of salivary glands are there? 3 pairs.
3 pairs.
Okay? 3 pairs of salivary glands are there, which secrete the saliva. So, if you see the salivary glands, see here, you can see one of this parotid gland, it is near your ear. Then this is sublingual gland, which is below your tongue, and submandibular, below the mandible there. So these are in pair. So each pair, one on both sides. So actually, if you see this sublingual gland, it is under the tongue. So actually, if you all know that in heart attack, the sorbitrate medicine is given. It is given under the tongue only. From there, it disperses very well and the absorption is fast. Okay. So this is, now what is this saliva here? Saliva is the first digestive juice or digestive enzyme. Okay. Which is secreted by the salivary gland. What does it have? Now, if you see the salivary gland, it is almost 1 to 1.5 liters daily. It is being secreted by these 3 glands. Have you ever seen any people complaining, मुंह बहुत सूख जाता है, dryness of mouth?
Yes, ma'am.
Yeah? So these salivary glands are not working well. Especially they don't work well after you've got fever or something. Okay, so actually, like fever में जब मुंह सूखता है, तो it is because it is showing dehydration and these glands are not working well. So if you work upon this, please mute. So in this salivary gland, there are lots of enzymes present.
वो लेना है इसका स्क्रीनशॉट कब कब पानी लेके रखा हुआ है ना पीने के लिए
Sorry. So there are lots of enzymes are present in it, and it is slightly acidic. Almost 6.3 to 6.8 is the pH of this saliva. Slightly acidic. Why it is acidic?
To kill bacteria.
So
Yes.
to prevent the bacteria from entering.
Yeah, so to prevent the bacteria from entering. And if you see animals, what they do, if they get injured, they lick. So actually, even I have seen, many people, like many times, they put the first saliva in the morning in their eyes. I mean, they tell me that any problem with the eyes, it gets cured, especially if you have conjunctivitis or something. I have not tried any time, but I just know about that. Okay, so that is about the salivary glands. Now, the salivary glands, what kind of enzyme it has?
Ptyalin.
Ptyalin. What does it do?
Yes, carbohydrate. It has a carbohydrate.
Ptyalin or amylase.
Amylase or
Okay.
ptyalin.
This ptyalin or amylase, what it will do? It will digest
Carbohydrate.
carbohydrate. In the sense, what it will do? It will break the complex carbohydrate into simple sugar. तो आपका जो फर्स्ट डाइजेशन हो रहा है वो माउथ में ही हो रहा है. Okay, so it is taking place in the mouth. So actually, when you chew, this ptyalin and amylase is released, which will help digesting your carbohydrates. Now you can relate to the people of diabetes that when they don't chew, why they have problem with carbohydrate metabolism. It is because this ptyalin and amylase is not released, because of which they have problem. So even if they change this habit, they will definitely help to cure the disease by root. Okay. And then what this amylase does it? It converts it into maltose. That is the simple sugar. So it will convert it into maltose, simple sugar. Okay. And this maltose, then it will get converted to glucose. So see how easy.
Please repeat.
Yeah.
Please repeat again.
Yeah, this tyline or amylase, it will work upon from the saliva, your tyline and amylase is released, which will work upon your carbohydrate, and it will convert it into maltose, and this maltose, it will get converted into glucose, which is the smallest unit of carbohydrate. Okay. So just imagine if your tongue doesn't roll properly, you don't chew properly, saliva is not secreted properly, will there be indigestion or not? होगा या नहीं indigestion? होगा ना?
Yes, ma'am. Yes, ma'am.
Yeah. So we have to be very, very, I mean, while eating, we should be very focused and concentrate on your food, chew it properly, because after you chew your chapati and rice, what you get sweet taste in the mouth, you get, that is the signal that it has been converted to glucose. Now you can gulp it. Now you can swallow it. Right? Now coming to the next one. From here now, where the food will go now? It will go to the food pipe, right? Now, if you see here, who is there in front?
Thyroid gland.
Thyroid
Ma'am,
gland.
wind.
Okay.
Ma'am, windpipe.
Ma'am, windpipe.
Windpipe. Actually, see now here you can see it very clearly in this picture. See here. Who is at the last back side? This is your vertebral column. Okay. Then after the vertebral column, it is your food pipe. And in front, there is trachea. Okay. Or the windpipe. Okay. So now here, I have shown this, I've got this picture to show you this epiglottis. See now the green colored one is the food. When it is comes down, what is happening? There is this epiglottis. Epiglottis is a flap. What it will do? It is erect. And when you are eating, what will happen? That flap will go and cover the windpipe so that no food particle goes into the windpipe. आप बहुत बार खाते खाते बात करते हो तो आपको खांसी आती है, ठसका लगला म्हणतो आम्ही मराठी मध्ये, है ना? तो वो क्या हो रहा है कि ये जो आपका विंड पाइप है वो उसमें फूड पार्टिकल चला जा रहा है, उसके कारण आपको प्रॉब्लम हो रही है. फाइन. So this is something very, very simple. Now, how is this food pipe? How it is? ये पिचकी हुई आपकी जो पाइप होती है पानी की नली, soft, it is that way. Okay. So actually, it is only when the food comes, it will dilate. Otherwise, it will not. Okay. So otherwise, it will remain in collapsed form. So actually, if we see, swallowing and breathing, we don't do together. They are two different processes and they take place separately only. Okay. So yeah, we should remember that while eating, we should never talk. So that is something very important, so that it goes into the food pipe only. And we have seen deaths, if the food goes into the windpipe, people are choked to death. Okay. So many times in the hospitals, so it is very common, like if the patient is vomiting and he's talking at the same time, and if the vomitus goes inside the windpipe, immediately patient dies. So not talking while eating is something very good. Now, if you see this windpipe has mucus glands, right? See, this is your food pipe. Sorry, I'm talking about the food pipe. This food pipe, it has got mucus glands. Why it has got mucus glands?
To keep the food moistened and move down.
Yes, to pass on the food down so that it should not, otherwise what will happen? The food will get stuck here, it will get stuck here, it will not go down. So in this food pipe, there is a peristaltic movement. So this peristaltic movement, it takes place, and the food, whenever you to swallow, you don't feel that the food remains here only, right? It goes down, and it comes and falls here. That is the cardiac sphincter. That is the opening of the stomach. Okay, so this food pipe, it has got constantly it is relaxing, contracting. So whenever the food comes, the mucus glands, they secrete the mucus, and the food is slided down. Okay, so the secretions, whatever are there, they all help it to come down to the stomach. Now here, when the food comes, there is a sphincter here, as I told you, where it is coming to the stomach. Now the food is coming. We saw the salivary glands, the saliva, it is slightly acidic, right? Now, when it is coming to the stomach, now here, see, you can see this J-shaped big bag, and it is very elastic. It is fibroelastic bag. It can have almost 1.5 to 2 liters of food, and what to say, the liquids. The upper portion of it, it is known as the fundus. This is the body, and the last and lower end of it, it is known as the pylorus. And see, this is on the right side, left side. This is the greater curvature, and this is the lesser curvature. And here now, if you see, there are various layers here. Okay, and this there is a thick mucus layer here, and here only the HCl, the hydrochloric acid, it is being secreted. Now this hydrochloric acid, how much is the pH of that hydrochloric acid? Almost 1.2 to 0.8. Okay, so if you put any steel nail, yeah, or a blade in it, it will get dissolved. It is that acidic. Okay, so now you all can remember, understand that this stomach, it is absorbing the gastric, it is secreting the gastric juice. It is secreting hydrochloric acid, and it is secreting various enzymes also. Okay, so if you see the function of the stomach, what is the function? First, it stores the food. So food is there. For how many hours the food is there in the stomach? It is for 3 to 4 hours. 3 to 4 hours. So now if somebody is complaining that I get problem, I get acid burning or acid reflux after 5 hours of taking the food, then we definitely know that this is not the problem of the stomach. But if the patient says that I have problem after taking the food, after 1.5 to 2 hours, I start getting acid reflux, then yes, it is the problem of the stomach. So we have to understand that. Then it is secreting some gastric juices. Yesterday we spoke about the gastric juices and the neurotropic factors. So they are something very, very important. When it mixes with the food, then only when it goes to the blood, so blood can make nice hemoglobin for you. And then the third, it will secrete the HCl acid. Now how the HCl acid is secreting? It is getting secreted from the oxyntic cells. I'll write down there, oxyntic cells. There are these specialized cells, oxyntic cells, which secrete the HCl. Then secondly, mucus cells, what they will do? They will secrete the mucus. Okay. And the third one is the peptic cells. What will the peptic cells secrete?
Enzymes.
Peptides.
Gastric juices and enzymes. Okay, so now if you you all know, many times people get acid reflux. Okay, and what they do is they treated that I have got hyperacidity, right? People say मुझे तो acidity का problem है, ऐसे बोलते हैं. So actually, whenever this is not common in allopathy, they will never ask, but in acupressure we should always ask whether it is hypoacidity or hyperacidity. See, now what is the difference between the two? If it is hyperacidity, there is HCl, strong HCl. What is the pH of this HCl? We saw it is 1.2 say 1.5. Okay, Okay, so it's 1.2 to 1.5. So now this when HCl is being secreted, this is highly acidic, and you are hungry and you don't take food, then what will happen? It will
Nail
start
eating its
Over.
its own mucus lining. It will start eroding that because it is hungry. It is so highly acidic. It will start eating its own mucus lining. This will not happen in a day or two. If you keep doing it regularly, then it will take place. So actually, like whenever you feel hungry, you should definitely eat because the hydrochloric acid is being secreted. But now many times what happens, people they have this HCl, it is the pH which should be 1.2 to 1.5. It is generally 3, 4. Is it alkaline or acidic now?
Acidic.
It's still acidic.
No, it is still acidic, but compared to what it was
It
normally,
be,
what
it's
it is?
less acidic.
Yes, it is
Less
less
Less.
acidic, so it is towards alkaline. So now whatever food is coming here, will it get digested properly? No, right? So if the food will not get digested properly because it needs this proper 1.2 to 1.5 pH. So now what will happen? The food will not get digested here and the food will remain here. And if the food doesn't get digested, what it will do? It will start getting fermented. और अनडाइजेस्टेड फूड आपने कभी अगर आपने छोला वगैरह ऐसे ही बाहर रख दिया तो क्या होता है, उसमें फंगस लगता है ना. वैसे ही यहाँ पे अगर वो अनडाइजेस्टेड फूड रह जाएगा तो what will happen? Again you will get the symptoms of acidity, but now it is because of the hypoacidity. So because the HCl is not strong enough, so definitely always you should make difference, like you should find out the symptoms, whether they are the symptoms of hypoacidity or hyperacidity, and then treat accordingly. Okay, so this is something we are going to remember. Now after that, like when the food is digested, now what is happening? Here there is the pyloric end. Now here there is a pyloric sphincter. Okay, so when it has been mixed well, now how does your stomach mix well? It works like a mixie. It will work like this, like this, like this, very well to mix the food. If you don't chew the food, then the stomach, it has to chew it very well. It has to make it into small pieces, so it will have to work harder. And because of that, many times the heat in the stomach, it increases. And then then we say there is heat in the stomach. So because it is working more, अगर आप मिक्सर भी ज्यादा चला लोगे तो गर्म हो जाएगा ना. वैसे ही अगर पेट में का मिक्सर ये ज्यादा चल गया तो उसके कारण भी ये गर्मी पैदा करेगा. And then you can see it heat in the stomach accordingly. Okay, so after that, now this food, it is coming into the duodenum. It is the first part of the small intestine now. Okay, now this duodenum, this is the first part of the small intestine, and see, you can see here it is very thick. Okay, it is something very, very thick lining it has got. The walls of this duodenum, they are very thick. See here, now you can see very well. This is the first part, the duodenum. This is the small intestine. Then coming to the second part, see, you can see here the second part here, all this. This is the second part of the small intestine, that is known as the jejunum. And see here, you can see the last part of this small intestine, which is getting connected to the large intestine. It is known as the ileum. Okay, ileum it is. Okay, there is one bone also by the name of ileum again in the pelvis. So this is the last part, is the ileum. So first part is your duodenum, second part is your jejunum, and third is your ileum. Now, whatever the food has come into this duodenum, it is getting mixed with, see, who is providing? The gallbladder, the liver, the pancreas. They are all putting their secretions into it. Now, what will the liver provide? What is liver making?
Bile.
Bile juice.
Bile juice. What is gallbladder got?
Bile juice.
Concentrated bile juice. So whenever the fat comes, So this gallbladder will put all its material into it. So now why people get gallbladder stones? Because many times, they don't eat only the fatty things. So because of which the gallbladder cannot squeeze out its contents. So because of that, it remains there. And if the heat is there, it will form the stones. Okay. So if you see here now, this gallbladder, it has got this cystic duct. Okay. It is coming from it here. And here you can see the hepatic duct. Hepatic duct means it is coming from the liver. And then when they come together, then they form the common bile duct. Okay. And in this common bile duct only, see here, the pancreas is also putting all its secretion here. And then this common bile duct, it joins into the duodenum, and it is pouring all its liquid into the duodenum to mix with the food, whatever is coming from the stomach. Okay. Now we saw how was the stomach pH. How was the stomach pH?
1.2 to 1.5.
Yes, it was highly acidic, right? Now this bile, the pH of the bile, it is alkaline. The pH of this pancreas, again, it is alkaline. pH of the bile coming from the liver, it is alkaline. Why it is alkaline? So that now the enzymes, they can start working upon the food which has come here, and then it can be absorbed very easily. Okay. So this is the, everything is mixing here in the duodenum. In the duodenum, very highly acidic bolus is coming, and then this is mixing all the juices, then it is becoming alkaline. So now if you see here, this pancreas, this pancreas. Now this pancreas, actually we all know that it has got two functions. What are the two functions of pancreas? Yes, exocrine and endocrine. So exocrine one, that is producing the pancreatic juice. Okay. And the endocrine one, it is producing the insulin. Okay. So this is insulin and this is the pancreatic juice. So this is one of the gland in the body which is producing, which has both exocrine and endocrine function. There is one more gland in the body. You should tell me next time. It also has two functions. So here, see, you can see everything is coming here. And now from the duodenum, now where it is going? It is going into the small intestine. Now, the small intestine, from here now, everything will start getting absorbed. Okay, it has got, see, it is, we spoke about that, though it is looking very small, very big, but since it has got narrow diameter, this is the small intestine. Now, how the food will get absorbed from here? If you see, this is one of the villi. It will get absorbed through the villi. Okay. So actually, if you see here in the center, you can see here, this one is the lacteal, which will absorb all the fat present in the food. Okay. Then there are arteries. Then there are veins. See, you can see the lymph is also there. And how it will absorb all this? See, it has got brush border like this. Your intestine, it is lined like this all along. So this is each single one, it is villus. And so many of them, they are villi. So this is so that, maximum absorption can take place. So because of that, this villi, the brush borders, what they call it, मैक्सिमम एब्जॉर्प्शन विल टेक प्लेस. सो एक्चुअली अगर आप देखें तो हमारे यहाँ पे क्या कहते हैं, खाना सूखा नहीं होना चाहिए. अदरवाइज समटाइम दे से सूखी रोटी खा लेंगे, कोई प्रॉब्लम नहीं, पर ऐसे नहीं चाहिए. तो व्हाई इट इज दैट, इफ द फूड इज वेट, it can be very well absorbed with all the enzymes and all. So when it come here, it is in the form of slurry and it can be easily absorbed by the intestines. Okay, so if you see this villus, so actually, like, it how it will work, it works upon two systems. First one is the, what it will do, chopping. Whenever the food comes to the small intestine, what it will do, it will chop. See, stomach has chopped it. It has made it into bolus. But now when it comes here, again, it will do chopping. Then what it will do the segmentation movement it will do. And then the third one, what it will do? It will do the peristaltic movement and take it ahead. Peristalsis. So means what is happening? So now when the chopping is being done, means it is being cutting. Segmentation. See now your small intestine is something like this. Okay. So in this, here the segmentation process is taking place. It is contraction and relaxation happening where? In peristalsis movement. So but before that, each of the segment, what it is doing, they're again making it into fine slurry so that it can be absorbed. And then what it will do, it will contract and push it forward. And again here, again the segmentation will take place. Then again with the contraction, it will push it ahead. So in the whole of the small intestine, it takes place. And it takes place for how long? 8 to 10 hours. Okay, 8 to 10 hours this is being done here. So what here it is doing? First thing, it is doing secretion. This is intestine is also secreting intestinal juices. You know, it is secreting the intestinal juices. So आपका जो protein है वो भी यहाँ पे बहुत अच्छे से digest होता है. So secretions are there. Then after that, it is digestion. Digestion means what? Breakdown. Again, the breakdown is taking place here. After that, absorption. Absorption. That is taking place here. So again, secretion, digestion and absorption of the food, it is taking place in this small intestine. Okay. Clear everyone now? Abhi tak ka pura journey, right? Now,
Yes.
end part is your large intestine now. See from here, it came to the first part, mix ho gaya sab bile yahan pe. After that, here the absorption has taken place. And now in the third part, what is happening? Whatever it has absorbed, it has been absorbed and put in the blood. Now whatever remains are there, it is being pushed into the large intestine on the right side. Okay, now this is your right side. This is the right side and this is the left side. So on the right side, like you will come to know the importance of this when you especially learn about Dr. Wolf's. So here what is happening? Putting everything into this large intestine, there is a gate pass here. Gate I'll call cecum. That is known as the cecum. And here this is the gate pass, the appendix. So this appendix also we spoke about yesterday, that it is a lymphoid tissue, and whatever the infections are coming from the lower holes, it will help prevent coming in those. So now whatever the material was there, the waste, everything is being put into the large intestine out here through the ileum to cecum. So this is known as the ileocecal junction. This is the ileocecal junction. Many times, you know, here also there is blockage. So actually only if you just pull it with your hand, no, that time also that blockage, it just goes away. So many times the pain in the abdomen can be because of this ileocecal junction में constipation अगर है, so if that constipated material stuck there, then the pain can come. Okay. So now from here, see how the waste will move. It will move up against the gravity. See now your blood is also moving against the gravity, but when the blood moves, it is still little denser, but the waste material is more denser. Okay. And this is going up against the gravity. And here there are all the nerve impulses. So now who controls the nerve impulses? It is the brain. So actually, if you see many times, if the constipation is there, what we say, one is constipated. So if one cannot think, we also say that he's constipated in his thoughts, right? We say that many times. So why it is that? Because there is the connection of this gut to the brain. Okay, so gut brain, because of this gut brain connection, there is if this portion of yours is I mean moving nicely, working well, Your brain will also work well. But if you're constipated here, definitely there will be problem in your thinking process or thought process also. So this is something very, very important to understand. And then if you see it from here, this is the hepatic junction, the right colic flexure. From here, it will go like this to the transverse colon. This is the transverse colon. And from the transverse colon, it will come down, descending colon. And now here, actually, this is just a C, but this is not C. It is S-shaped. This sigmoid colon, it is S-shaped. Okay. So actually, the all the waste, it is coming here. Now, actually, like if you see here, this large intestine, it is just not going against the gravity. Whatever the water present, it will absorb that. Then it has got some good bacteria also, right? So those good bacteria, what will they do? They will help in synthesis of the vitamin B12 and vitamin K also. So actually we have seen many times that if somebody is having regular non-veg and people feel that they are having the B12 and the vegetarians don't have. It is not that. If this large intestine, if heat is present, if it is constipated, the B12 deficiency will definitely be there. So whenever somebody has got vitamin B12 deficiency, you should think about this also, that whether the large intestine has got some problem or not, whether the heat is being accumulated, whether the patient is constipated, you are supposed to find out that. So this sigmoid colon, what I was talking about, here many times, the waste, it gets stuck here, and maximum cancers are seen here. So sigmoid colon cancers, they are seen here. And many times we have also seen this now appendix, we all know what happens when the the waste gets stuck here. And because of that, like, अगर कोई भी चीज ज्यादा देर वहां पे रुक गई, sudden पैदा करेगी, so it will cause infection. So something similar also, this appendix can get infected, and then it will cause inflammation, and because of it, the pain can be there. Okay, so this sigmoid colon and this one. So appendix is removed in many cases, but we feel that it helps to impart immunity, so it should not be removed. And definitely, like if you keep your large intestine in good working condition, there will be no sigmoid colon cancer. But this has been seen more in the seniors. And after that, the waste, all comes in the rectum. This is the rectum, rectal canal, and here it gets accumulated. When this is full, then now if you see here there are two sphincters. Okay, one is the internal sphincter and another one is the outer sphincter. And this the message goes to the brain again via the nerve reflex, and it opens the internal sphincter. And that time one gets the feeling that they have to defecate. And when this external sphincter, which is in the voluntary control, one can go and defecate from here. Okay, so this is something very, very important to understand, that when one gets an urge to defecate, we should never stop it, because it helps in the functioning, a proper functioning of your whole system, the digestive system. Now coming to the last part. Now this was the last part, of course, definitely. But now if you see your large intestine and the small intestine, they are kept in proper place by one. First is the omentum. Okay, the omentum. Omentum is one which is in the front, and at the back side is the mesentery. Okay, so they will, both of them help to keep the intestines in place. It doesn't happen that you run or you cough or you laugh and the intestine just come out, right? It never happens. Only thing is, like when if it becomes very thin, the lining of the intestine, they become thin, and if you put excessive pressure on it, like lifting the weights or kicking the scooter, so that time only like the intestines come out, and then it is called as the hernia. So actually keeping the walls of your intestine strong is something, a very good idea. For that, not only the walls, the whole digestive system has to be kept in good shape. So you will get the mesenteric plexus point also in Dr. Wool's. When we learn about that, we'll know about that also. So this is the mesentery and the omentum. See, this is the front part. It is keeping everything in place, the lesser omentum and the greater omentum. So even if somebody's got lots of belly fat, it doesn't just, the intestines don't come out. Okay. Any other question now you have? Tell me.
Ma'am, sorry to ask again.
Yeah.
You were saying you said something that if a person feels acidic, hyper or hypoacidity after eating food after 2 hours, and then maybe if after 4-5 hours, there was some difference. I just lost the connection, so I couldn't
What I
hear.
was telling you that, see, this food remains in the stomach for 3 to 4 hours, right? So actually, if you have problem, someone has a tendency to vomit, or they have the acid reflux within having the food after 3 hours, or in within 3 hours, then it is the problem of the stomach. But if it is later, then it can be some other problem. So it is not of the problem of the stomach. Okay. And hypoacidity and hyperacidity, they are totally different conditions. So hyperacidity means more acidic, more acid is being produced. In hypoacidity, less acid is being produced, because of which the food is not getting digested properly. So there is indigestion. Because of that, the problem is coming. And many times what happens, people just keep taking Gelusil or some antacids, and still they, the acid, they reduce the pH. They make it more alkaline. So then again, the problem is worse. So if somebody's got acidity and he's taking the antacid, we've never seen that those people get cured. They have more problems.
Okay, thank you, ma'am.
Ma'am, one question of mine. So the total journey of the food from our lips to our anus is around assumed as 14 to 18 hours, right? In our GIT. Right. Now, normal human persons consume 3 times a meal a day, right? Breakfast, lunch, or dinner, and if possible, between supper and brunch or whatever you can say. So, is it okay if a patient comes and say, "I defecate 3 to 4 times a day," or something like that? Not immediately after food, maybe after 3 hours of food, or after 2 or 3 hours of some proper rest. He says, "I feel like defecating." बिकॉज हम लोग ने तो बड़े लोग से सीखा कि आप सुबह एक बार डिफिकेट हो जाओ तो अच्छा है, दिन भर में अगर 3-4 बार हो रहे हो तो दैट मीन्स यू आर कॉन्स्टिपेटेड. तो हाउ डू यू कोरिलेट दिस?
No, actually, see, you can, when you eat food, say 2 to 3 times a day, you can defecate twice a day. That is in Ayurveda also, they've said it is normal, because everybody's system works differently. So no, that is the okay. But if it is, yes, more than 3 to 4 times, then you have to find the cause why it is happening. So though it is not immediately after the food, but still there is some problem. So the digestion is not taking place properly. So that is why, as I told you yesterday also, that one has to check what is the color of the stool, what is the consistency of the stool. That is also something very, very important.
That's okay, ma'am. Like my example, I'll tell you. Let's say we had our lunch at 1 o'clock. Okay, plus 18 hours. If we say
No, don't take it that way.
so,
If you are
early
saying the
morning
journey,
meditation is
no. Wait. Let me answer first. Actually, what is happening? 18 hours. अगर आपने एक फूड खा लिया, आप सोच रहे हो कि 18 घंटे के बाद में ही मैंने दूसरा फूड लेना है, ऐसे नहीं होना चाहिए. It is a continuous process going on. Your body is working continuously. It is needing its food continuously. So if you see, like if somebody is working for 24 hours, there are shifts. So this is also taking place in the shift form only. So it is not that ki only after my 18 hours I will take the next one, but 18 hours tak iska kaam pura ho jayega, but the other process has to start.
hey, my question is the lunch from there I calculate 18 hours. So early morning defecation is okay, but what about the dinner then? From there again I start again 18 hours, and by afternoon 3 o'clock or something, I will assume something.
No, so it is everybody's according to the habit it is. So actually,
Okay.
like 3 o'clock, I mean, after 4 o'clock, I mean, twice a day, so definitely one can defecate, and it is normal. Like if the patient doesn't have any other problem, it is definitely normal.
And what about the thing that usually we say that 1 day of fasting in one fortnight is good for health? You give your stomach rest, your T cells are developed, and you just said if we don't consume something, then HCl is more gets more. We might get acidity or something.
Yeah, so actually, like if somebody is getting that problem, that means his body is not allowing. So actually, giving rest to the body means what? Actually, it is not that said that you should not have anything. So if you feel that you are not able to work anything, you are supposed to consume something. So actually, like an Ekadashi, what they do is what generally you do on Ekadashi. Actually,
It is
in
usually Ekadasi with Nirajal also. They don't take water
so
also. One
yes.
time water in the 24 hours.
Yes, that is only once in a year. That Nirajal Ekadashi is only once in a year, right? So it is not regularly. I mean, regularly in the sense every Ekadashi it is not done. But otherwise, in some communities, they don't eat rice, or in some communities, they take only kanji, और इन सम कम्युनिटीज दे जस्ट पुट दिस थिंग आंवला आंवला को मुंह में रखते हैं तो सलाइवा अच्छे से होता है तो वो तकलीफ नहीं देता है सो इट इज अकॉर्डिंग टू द एवरीबडीज bodies need. So actually, we say that if the fasting, what you are saying, if somebody has got some very rare disease or cancer form, like in that case, yes, you can then do this type of fasting so that it can stop because you know the food for cancer, like I mean, वो आप उनको भूखा मारोगे तो वो grow नहीं होंगे. So that is
In
the
fact, we have seen our Jain system of doing. They do fasting for 11 days only on the chuna pani. That they're adding calcium to the water and consuming to
okay.
make the alkalinity inside the body to contract with the HCl,
No, but
basically.
they don't do it regularly, like monthly or weekly. They must not be doing that. No, it must be once in a year, or I mean, मतलब कभी जब
But ma'am, it is 11 days continuously. Some people do 21 days
no, so
continuously.
the body हर एक का बॉडी अलग रिस्पॉन्ड करता है तो जिसको अच्छे से रिस्पॉन्ड करता है वो कोई 5 दिन करेगा कोई 11 दिन करेगा तो इट विल बी अकॉर्डिंग टू द एवरीबडीज नीड्स. So but it is not done. I'm just trying to tell you that on a मतलब हर वीक हर मंथ ऐसे नहीं करते हैं उसको. So उसको
ठीक है
कभी
मैम,
कभी
लेकिन ये 11 दिन 21 दिन भी तो हार्म करता है ना बॉडी को, ये मैं बोल रहा हूँ.
नहीं तो वो उनको कोई
साइंटिफिक.
प्रॉब्लम आई मीन इफ दे डोंट हैव एनी प्रॉब्लम टच वुड गुड इट इज गुड फॉर देयर बॉडी बट इफ दे हैव प्रॉब्लम यस दे शुड नॉट डू इट. तो हर एक का बॉडी अलग अलग सिम्टम देगा. सो दिस इज व्हाट लाइक यू नो we have learned in acupressure that everybody's body is different. Everybody's body will give different symptoms. अगर आपको हेडेक है हेडेक का एक ही कारण नहीं है दसियों कारण है उसके तो उसका कारण आपको ढूंढना है. तो इनमें अगर कोई सब में प्रॉब्लम नहीं है तो दैट इज समथिंग वेरी नाइस. बट अगर कोई प्रॉब्लम है किसी को दे कैन नॉट डू इट देन यस यू हैव टू फाइंड द कॉज एंड ट्रीट दैट कॉज. तो इट इज अकॉर्डिंग टू एवरीबडीज नीड्स. एवरी जिसका बॉडी जैसे है उसके हिसाब से आप उसको ट्रीट करें. तो जनरली अगर आप देखोगे तो आयुर्वेदा में उन्होंने बोला है हफ्ते में से एक बार शाम का खाना नहीं खाने का है. उन्होंने दिन में का खाना नहीं बोला है. शाम का खाना नहीं खाना चाहिए बिकॉज इन द डे टाइम योर बॉडी इज मूविंग इट नीड्स एनर्जी. Okay, so they have said that in the evening you should not take food and give rest to the system. So actually like
This is
जिसको
what we
जैसे
say intermittent fasting, like 12 hours of gap between one meal to the next meal.
yeah no actually intermittent fasting is something 16 hours so but we don't advise that 16 hours fasting. तो जैसे आप अगर 7 7:30 को अभी खा लो तो सुबह में आप 8 बजे नाश्ता कर लो so that is good enough. Like 12 hours fasting is good enough. So but it will definitely vary from each one's body. So it cannot be the same thing for everyone.
And what about during digestion and absorption of this gastric or useful this thing? we get some kind of sounds from the stomach. We get
Yes.
some kind of this thing from stomach. So, is it a good sign? That's what I'm going to say.
No, so this your small intestine is telling you that it needs attention. So generally, a small intestine gives out that sign. So where is the problem? You have to find out that. Yeah, Vasudha ji is asking, ma'am, can food remain for more than 4 hours in stomach due to hypoacidity? Yes, it can, and it can contribute to acid reflux. So generally, if you see, like when this hypoacidity takes place, आप क्या करते हो, पेट को सहलाते हो, तो उससे आपको अच्छा लगता है. There are certain points on this area. So definitely you should do that so that the food moves ahead. It has to, in fact, like, I was to talk about the points. There is a needle formula that is something very, very good for your digestive system. So if you want to improve the digestive system, there is a 10 needle formula given in your treatise 15, P6, CV13, CV12, CV10, CV6, ST36. So these are something really very nice points. So if somebody has got this hypoacidity, Vasudhaji, you can definitely try this 10 needle formula. Yeah, tell me, Amitaji.
Ma'am, first of all, thank you so much for such lovely revision. I'm enjoying it. It's everything is coming so easily and nicely, and everything is getting revised so nicely. So thank you so much, ma'am. And here I was trying to connect TCM's organ clock with what we discussed today. So now when we say the stomach time is from 7 to 9 a.m. in the morning, so 7 to 9 p.m. will be its weak point, weak
Yes.
energy point. So when we say that we have to eat before sunset, that is between 7 to 7:30. So how do we justify over here when the stomach is going to be weak at that time?
Actually, like, it is not, we always say before sunset. It is only in the Jainism, it has been recommended that you should have your food before the sunset. So actually, like, if you see now 7 to 9 is the stomach time in the morning. So if you have your breakfast at 8 o'clock in the morning, that is the optimum time. And now if you see the opposite time, when you are saying that it is weak, like, so what is the time out there? 7 to 9, it is the pericardium time, right?
Yes.
Pericardium, what is the energy of pericardium?
It's the heat.
Heat, right? So heat hai abhi, so when you put the food in it, will it not be digested properly then?
Okay.
So generally, that's why we take it 7 to 9 p.m. We don't take it even 9 to 11. Triple warmer. We don't take it because it is the yang organ. We take it 7 to 9 only. So, like, if you have it in the heat time, the food will be digested properly then.
Yeah, justified, ma'am. Yeah.
Justified.
So it is not necessary for the heat to be there in stomach organ. Heat, from somewhere the heat is being provided. That is good enough.
Yeah.
Okay.
So
Thank
actually,
you,
that's why we say, at night time that you should have light meal. So we don't actually, if you see, we have very good, nice, heavy lunch, but dinner is always lighter. In whichever part of the country you go, it is always lighter.
So you mean to say is we should always have food during our yin time?
No,
Not yang
actually,
time.
stomach time is yang time only, but stomach is a yin organ, definitely. Stomach is yin organ. I mean, it is taken in the yin organ. Though it is a yang organ, it is taken in the yin. So actually taking the food at 8 o'clock in the morning is something very, very helpful. And we've seen results. I have done it with many diabetes patients. So I have just asked them to have the food at 8 o'clock in the morning, the breakfast, and it has helped them definitely.
Thank you so much, ma'am. Thank you.
Thank you. Yeah, Meenakshi ji. Actually, like, yes, it is something because conserving your energy. I mean, what we learn in the Ayurveda, Ras, Rakta, Mas, Mej, Majja. And the last one is your Oj. So to have that Oj, yes, definitely, like, so as we grow old, definitely, if you see, all the pleasures what you seek, uska interest bhi kam hota hai, and people try to preserve their energy. So yes, actually it is best to eat food only when we feel hungry. Yes, it can be, but then you have to definitely strictly follow that. So whenever you feel hungry, then you should have the food, and you should not skip the meal then. नहीं तो फिर वो आपको तकलीफ देगा. But generally, if you treat, you put the habit to your body, it will definitely tell you that at the same time it will feel hungry and you need to eat at that time. So a healthy body, it comes into very nice, the biological clock very easily. So definitely you can try out that also. So generally 1 o'clock, that time also why we have the food, it is the heat period again. So 1 o'clock is also, it is between like heart to small intestine shifting. So that time also the food is digested very nicely. Again, the heat time. Okay. So with that, I have completed the digestive system. And there are very nice points for acidity also. I think everybody must be knowing those points. And yes, for the dewormings, you can use the lightness and darkness points, or origins, organ source, and the Z-clef points of the GIT system. That is large intestine, small intestine, and stomach meridian points. So they help very nicely. Thank you, sir.
So friends, before we end this session, there is a very important announcement there. Today we have finished the digestive system. The other systems will be taken up from Monday onwards. At the same Zoom ID, I'm going to send fixed. However, I'll send message to all the please attend. And another thing is, from every Friday and Saturday we are conducting semester classes separately for Ishan and SB Pass students. Those who have joined already for first semester, you will be intimated the Zoom link tomorrow evening. The class will be from 8:30 to 9:30. Dr. Antim Kumar Jain will take the class on Sujok system, because it is very essential that we should know Sujok system to treat. All our TCM meridians are based on that system, on correspondence. So if, basic fundamentals will be taught. This is for those who are enrolled for first semester, freshers, because it is very important to know, understand Sujok system also, to implement what you have understood the concept of TCM. So tomorrow 8:30 we have that class. All enrolled participants will get the message. Those who want to enroll, please contact me. We will include you in the group. On Monday, this class will continue. Okay, and on behalf of all the participants, it was a very interactive session. I mean, I didn't do Mukhastuti, means praise in front of our faculty, because it is already proven that she is one of the best faculties of our Samsthan. We are very, very proud of her. I thank her once again for rendering one more enthralling session today also. So thank you very much, madam. We will catch up again on Monday.
Yes.
Thank you, ma'am. Thank you.
Goodbye.
Goodbye, friends.
Thank you, ma'am.
Thank you, sir. Thank you, ma'am.
Thank you,
Thank
ma'am.
you,
Thanks
sir.
a lot.
Thank you, ma'am.
Thank you.
Thank you, sir.